Good afternoon, everyone. I'm Dr. Sameep Vakharwala, associated with the Pediatric Department here at SL Raheja Hospital, Mahim, Fortis Associate. With me here today is our Head of Department of Neonatology and Pediatrics, Dr. Asmita Mahajan. She is MD, DNB Pediatrics, DCH, with fellowship in neonatology. She has been associated with the hospital for over 14 years and experience of over 17 years. She's taking care of our NICU and PICU since then. Welcome, ma'am, to this live stream. Can you let everyone know about the purpose of this session?
Thank you, Sami. Thank you for hosting this session for us today. Yes, definitely. I'm excited to share with you all a few updates about our newly renovated pediatric wing, which is going to be a part of the Mother and Child Care Center, which will occupy a floor of this hospital. This newly renovated wing will have a lot of exciting features, which I want to share with you all today.
That sounds great, ma'am. I heard we are upgrading our NICU. Could you share more details about that?
Yes, the neonatal ICU will be a level 3, that is a tertiary level unit. Okay, we will be having two different sections in the NICU. One will be a inborn section, that is made to house the babies who are born in our own hospital, and there'll be a separate section for outborn babies which will get transferred to our unit from outside hospitals or other nursing homes. So these babies will be kept separate in two different rooms so as to manage their care effectively and safely. Also, the NICU is going to be quite spacious and we have planned it that way. We will also include a mother's feeding room where the mothers will have a comfortable resting area where they will get privacy also for expressing milk, and where in between the newborn care, or where they will be able to feed or care for their newborn babies or give kangaroo mother care to the newborn babies who are premature. Kangaroo mother care is a technique where the mother can rest comfortably in a reclining chair with the mother baby on her chest for skin to skin contact. This helps premature babies in developing better, good weight gain, fighting infections better, and it regularizes their heartbeat as well as their breathing very well. This gives a mother a sense of comfort that she is able to care or help in the management of her newborn baby who is premature and still has to gain weight. This is a part of the family centered care which we will always promote in our department.
Right. And this is also in line with the baby friendly hospital initiative. Could you please
Yes,
explain
this
why
will
would a
help
baby
the mothers
require?
to breastfeed in a better manner. The express milk of the mother and direct breastfeeding of the mother is the best thing which we can offer a newborn baby. It helps the babies to fight the infections better, gain weight faster, and it boosts their immunity in a way in which no other milk can. So, mother's own milk, which we call as mom to be short, is the main support an ICU baby requires to get better quickly. And this is what we need to promote by having this feeding room in our NICU vicinity.
Right. That's good to hear. I heard we are upgrading our NICU. So, can you tell me what are the common reasons why we would admit a baby in NICU?
Yes. So, our new NICU will have all technologically advanced and state of the art equipment. See, NICU reasons for admission to NICU are multiple. There are a variety of reasons for that. The most common I would like to say is probably prematurity. 25% or more than that of the babies are born premature or low birth weight. Some are extremely low birth weight, that is, their weight is less than 1 kg. Very low birth weight if their weight is less than 1.5 kg. And low birth weight if their weight is less than 2.5 kg. All these babies require extra support and monitoring, and they have a variety of issues which can be managed only in an NICU. Here, we will be monitoring these babies not just for sugar, some blood tests including calcium, etc., but also for a vital support of breathing and cardiac support if needed. For the first 24 to 48 hours, these babies may require ventilator support or other breathing support in the form of a CPAP machine. So we have the latest ventilators and advanced CPAP machine which can support the breathing of these babies and make them comfortable and stabilized as soon as possible. These babies' lungs are sometimes not well matured. That is why a protein called a surfactant is deficient in them. We have to artificially, as a medicine, give this protein to these babies and then put them on the ventilator or a CPAP machine. The CPAP also needs to be a very effective machine because this helps the babies to get off the ventilator quickly and sometimes to avoid the ventilation completely and helps in better and earlier recovery. We also have variety of other cases as well, like if the baby passes meconium inside the mother's uterus, they may have aspiration pneumonia. That is the meconium, that is the stools, may get enter into the lungs. This can cause pneumonia or breathing difficulty in the babies. There are many other causes of breathing difficulty as well. For example, cesarean babies having transient tachypnea. That means there is a temporary fast breathing which happens because of the liquid in the lungs not getting absorbed very quickly. Secondly, babies may have respiratory distress syndrome, meconium aspiration syndrome, or even pneumonia per se. Speaking about pneumonia, newborn babies sometimes have something called as sepsis. This may be a bloodstream infection in which the bacteria very rapidly spread through the blood of the baby, or it may be a pneumonia itself, or even meningitis, abscess, or even bone infections. These complications need IV antibiotics for various number of days depending on the condition. Other cases which we can manage in our NICU is jaundiced babies. Sometimes severely jaundiced babies require phototherapy, which is a blue light therapy. So we have the advanced LED phototherapy machines now in our unit so that they are more effective and the baby's jaundice is recovering very quickly and effectively. Sometimes these babies even require exchange transfusion. Rare, but yes, sometimes it is needed. And what we do is that we have to exchange the entire blood volume of the baby with fresh whole blood. This is a complicated procedure and has to be done under close monitoring of the newborn baby so that the heart, vital parameters, breathing, etc., remain well controlled and stabilized. Other conditions which we can manage in an ICU are post-surgical cases. For example, they may have some birth defects like tracheoesophageal fistula, neural tube defects, congenital heart disease, even gastrointestinal or abdomen defects, and so on. These cases need not just pre-operative but post-operative monitoring as well. The pain control and gentle, loving care of such babies post-operatively after the operation are extremely important. These are the number of cases which we manage. And also, very rarely, some babies go through a very difficult delivery. The delivery is not only difficult for the mother per se, but for the baby as well. Such babies may be born with the help of vacuum assisted deliveries or forceps deliveries, and sometimes the shoulder or some other part of the baby may get stuck during the delivery. Such babies may have some birth trauma or injury and require monitoring or treatment for the same. We do manage such babies effectively as well. Rarely, there is a delivery difficulty or some intrauterine problem in the baby. For example, the mother having either diabetes or pregnancy-induced high blood pressure, that is PIH. Such babies may have a compromised blood circulation inside the uterus as well. In such cases, when the baby is born or just before the baby is born, they sometimes do not cry immediately after birth. This is something which is a dreaded complication and called as birth asphyxia. The birth baby crying immediately after birth is like music to our neonatology ears, right? So, if the baby doesn't cry immediately, they may have a myriad complications. So, it requires expert NICU observation and monitoring and treatment because vital organs like the brain may be affected, causing fits or altered level of consciousness in the newborn. Cardiac muscles may be affected, so the blood pressure needs support of various medicines, as well as the blood supply to the kidney gets affected in such cases. The child may have renal failure, that is kidney failure, and accordingly treatment may be needed. So as you can see, Samir, a lot of variety of cases can be effectively managed in our NICU.
Right, I agree. That's quite a wide range, wide spectrum of disorders that can be managed in NICU. That was highly informative. Could you elaborate more about the PICU as well, ma'am?
Yes, definitely. Our PICU will be a four-bedded unit wherein we will be having an isolation room as well, the importance of which I'll tell you in a few minutes. The pediatric ICU will be able to manage a variety of complicated and critical illnesses in children. So newborns are the one who are till 28 days of life. That day onwards, the child becomes an infant till he or she is 1 year old. And then onward, we call them children. So whoever are not a newborn can be managed in a pediatric ICU. The pediatric ICU can have multiple cases which we can manage, including acute attack of asthma, other causes of breathing difficulty, pneumonia, sepsis, brain complications like meningitis, or seizures, status epilepsy in which the fits are not stopping despite different medicines, different post-surgical cases like again heart diseases, post-operative care for abdominal surgeries, orthopedic surgeries, and so on.
Could you tell us more about the team that we have at hand?
Yes, this is very important, Samit. As you know, um, a good pediatric ICU and a neonatal ICU anywhere in the world is incomplete without the team of doctors and nurses which mans it. So I'm proud to say that we have pediatric qualified doctors, qualified pediatricians, intensivists, and cardiac anesthetists and surgeons who are going to be taking care of the newborns as well as pediatric cases in our department. These doctors will be available round the clock, that is 24/7, to monitor the precious children. This is so important because the children are having a physiology, that is a body process which is very fragile, very delicate, and very volatile. Especially newborns, their conditions sometimes change from hour to hour and minute to minute. So they need an extremely close monitoring and they can never be left unattended or unmonitored. That is the importance of an ICU, which is handled by qualified people, expertise of whom will be needed to manage every minute to minute change in the newborn or the child.
Right.
Of course, the nurses are the backbone of any good pediatric and neonatal unit. So I'm proud to say that we have extremely professionally experienced as well as loving and compassionate nurses. These nurses ably support the doctors in managing each and every case. They are able to handle emergencies as well. They are able to help the doctor in CPR cases as well. And a lot of procedures are expertly aided and supported by the nurses. Your precious bundles of joy will definitely be aided and supported and managed with loving and tender care by these nurses who will actually do the job of a mother who cannot be present inside the ICU. So be rest assured that professionalism and compassion both will be the pillar stones of the management of children in our new child care center.
Right. That's good to hear. A team is nothing without its individual members.
Yes.
We've had a fair share of extremely challenging cases over the past 2 years. Could you shine some light on those cases, ma'am?
Thank you. Thank you, Samit, for bringing that up. Yes, definitely. I would like to share a few really challenging cases that our unit, which has been working in this hospital since the past nearly 14 years, and I have been here since the inception of this department. So, over these years, there have been definitely a variety of challenging cases which we have managed. We have been able to thankfully manage a baby who was extremely premature, nearly 800 grams at birth, and was transferred to us from outside hospital. The baby had immediate complications like needing respiratory support, was on ventilator for a quite a long duration of time. After that, needed oxygen, was dependent on oxygen for a long period of time, and then later turned out to have infections and other complications like hernia, which required a surgery, and something called as neonatal cholestasis, requiring a gallbladder removal surgery. This baby stayed with us for an astounding nearly 3 months, and I'm happy to say and gratified to see the baby having grown into a nearly 3-year-old healthy and normal child. Another challenging case was that of acute necrotizing encephalitis. This is an extremely rare condition, and not more than 15 or 20 cases have been reported so far. We saw that the child had just 1 day of history of fever and surprisingly and alarmingly progressed into a case where she was disoriented and had altered level of consciousness and went into a coma by the second day of illness. She was comatose for nearly 10 to 15 days and was on ventilator and other life care support. Happy to share with you all, after a 1 month of relentless fighting various complications and various challenges, we were able to save the child and send the child successfully home. And after a year of that illness has passed, the child is now normal, healthy, going to school and progressing very well day by day, despite a lot of physical challenges which they still face. A third interesting case I would just like to quickly mention is that of a premature baby who required peritoneal dialysis. The baby had not cried immediately after birth, and because of the blood supply being affected to the kidneys, had renal failure. Despite medicines being given, the medical management could not bring the kidney back into function. So we had to resort to peritoneal dialysis, and it was extremely challenging to do. And with the expertise of the pediatric surgeon, anesthetist, intensivist, and the nephrologist, we, because of this multidisciplinary support, were able to really bring this baby out of the renal failure. And after again a challenging 2 month stay, the baby went home well and is thriving well. Also, we did an extremely rare surgery that is called as gastric pull-up surgery for a case of tracheoesophageal fistula, in which the stomach is fashioned into the form of a food pipe and brought up into the chest of the baby so that the baby is able to intake the food properly. Otherwise, there was no chance that the baby could have, eaten food or taken milk intake. So the surgery was successful, and despite a lot of challenges in the post-operative period, the child has done well. Despite a ton of surgeries, nearly 8 or 9 surgeries, which the child has faced till now in their life. So these are the few challenging cases I was happy to share with you. It is extremely gratifying and gives us joy and happiness to see such sick and critically ill newborns and children getting well and growing up healthy and well.
Right. This is quite encouraging to hear that we are able to, successfully discharge these babies with not just medical but even surgical issues. We are able to correct them at time with early interventions and the right treatment. This is
True.
quite encouraging to hear. Are we also expanding our pediatric subspecialties? Can you elaborate on that?
Yes, we already have a team of expert subspecialties or super specialists. So we have on team a pediatric neurologist, pediatric cardiologists, pediatric orthopedic surgeons, pediatric ophthal, pediatric gastroenterologists, and pediatric respiratory specialists as well. With the pediatric hemato-oncology is an extremely important part of our department, because we see a lot of hemato-oncology cases, including leukemias and lymphomas, as our hospital is an oncology care center renowned in the area. These cases sometimes are very immunocompromised because of the chemotherapy. The children have compromised immunity, and hence they suffer from infections. These require pediatric ICU monitoring and support for the care and treatment to make them recover from the infection, or sometimes even a cardiorespiratory support is needed for these children.
Right.
So, you can see that we have a multidisciplinary team which can help us with not just the management, but sometimes the diagnosis of rare and very, dangerous illnesses which are not so commonly found. And the support of all the super specialists is extremely important in managing the cases well and appropriately.
Right. Good to hear that, ma'am. Will the new pediatric department look the same, or there's something special planned?
So I just told you about all the equipments which we will have. I enumerated the ventilators, which includes even a high frequency ventilator, I would like to add. So that is a ventilator which is specialized, not available everywhere. And the high frequency ventilator helps to manage cases which the normal ventilator is not able to manage. So rare cases like pneumothorax, where there is air which is, leaked out into the chest, pneumonia, sepsis, or respiratory distress syndromes, which are not getting better on the normal ventilation, can be put on a high frequency ventilator. We also have a good and state of the art CPAP machine, which can help the baby breathe on its own and yet provide breathing support. That is one thing. The phototherapy machines, like I said, are LED machines, and they are more effective in quickly reducing the jaundice of the newborn babies. The other machines which we have is a heated, humidified, high flow nasal cannula, HHFNC, which, as you know, has helped us manage nearly more than, I would say, 5 or 10 cases of severe and atypical pneumonias, in which the entire one side of the lung of the baby was completely affected. And yet, with extremely expert close monitoring of these babies, we were able to manage these cases without ventilator support on the HHFNC machine. So this machine is extremely important if we want to try and avoid a ventilator support for such babies. So complicated cases can be managed in a better and more effective manner. Of course, we have good radiant warmers where the newborns will be kept cozy, comfortable, and warm. Now, as you asked about the environment of the NICU and PICU, all these are the advanced, well equipped NICU and PICU description. But yes, the environment has been planned in a cheerful and child friendly manner. The entire floor will be made vibrant and more colorful, so that all these, the pictures, the wallpapers, the murals, everything will enhance the effect. It will create a sense of vibrance, energy, and hope. It will help the children stay more cheerful. A dedicated child's play area will be made in the lobby, where, the recovering children who are already out of their bed and all will get to spend some time where they can engage in entertainment and some, drawing, coloring activities, or some small safe toys which will be provided for them under supervision, of course. So the entire unit, the entire department, we have planned in a way which will be more child friendly, more vibrant, more colorful, which will hopefully help our tiny tots to heal and recover in a wonderful manner.
That's excellent to hear, ma'am. So we are not just upgrading, we are taking it to the next level. I'm looking forward to working in such an enhanced setup. I'm sure it's a huge boost for pediatric and neonatal care in Mahim and the surrounding region.
Yes, definitely, Sameep. With the help of my entire team, I am happy to say that the enhanced, renovated, and well equipped NICU and PICU, which is an excellent support to a high risk obstetric care practice, also, which our hospital provides, will take the pediatric care of SL Raheja Hospital to the next level, definitely. Let's do this together. Let's care for each and every child with utmost care, professionalism, and yet compassion. I'm proud to say that our entire team is available round the clock whenever needed for the children to make sure that they can face and fight their illnesses effectively in the most comfortable and most as much as possible pain-free manner as possible. We always use procedures and methods which will keep the child as comfortable as possible. The parents are always counseled about the child each and every day. The even tiniest thing which happens to the child, the blood investigations, any investigations, any updates about the medical condition are always informed to the parents so that they are always taken in the loop, taken into confidence while managing the child who is very precious to them, obviously. This is the aim of the pediatric department and our childcare center moving forward.
Thank you so much, ma'am, for the highly informative and interesting update on our pediatric department.
Thank you, Samir. Thank you so much for having this session with me. Hopefully, all the people will come to know of the department properly and will feel the confidence needed to provide the child in our care. Looking forward to make tiny tots better towards a more healthy and wonderful life. Thank you.
Thank you, everyone.